I'm Brian Firth. I'm going to speak to you today about the most overlooked thing with your kids, their breathing. Do you have a son or daughter with asthma? Look at their mouth. I guarantee you that they won't have a closed lip posture at rest. Does your child sleep well, wake refreshed, have plenty of energy during the day? Are you interested in your kids' teeth development? Of course you are. Look at their mouth. Check out their mouth. Are their lips together when they're not eating, drinking or speaking? Or are they like this? Or like this? If not, then their breathing has already permanently changed. All people with asthma all breathe incorrectly, no exceptions. Their body then reacts by squeezing the bronchial tubes, causing the asthma response and lots of other problems. Skin, sleep, dental, nasal problem. Here's the thing. Everybody is familiar in life with what happens when people overeat. They gradually and permanently become overweight till they do something significant about it. Well, here's what people don't get. Exactly the same thing happens with your breathing. When people overbreathe, now overbreathing is any kind of mouth breathing at rest. So walking, sitting, sleeping, sitting in front of a screen. Oh, kids don't do much of that these days, do they? Oh, look at their mouth. This permanent, usually mouth breathing, is the real cause of asthma: poor sleep, poor concentration, limited sporting performance, problems learning wind instruments in particular, swollen tonsils, lots of colds, hay fever, nasal problems and malocclusion. The problem is that modern medicine treats all these problems separately and symptomatically only. Drugs only. Surgery, splints, braces only. This can be corrected in one hit by a breathing retraining course. And oh, what a change it'll make. It's not a miracle. It takes a couple of days. It's called a Buteyko Institute Method. If done properly, BIBH ISO 9002. Medication-only treatments, the so-called asthma control, means asthmatics never get better, and their all-the-time breathing remains incorrect. They become a trigger waiting to happen. Oh, a bit of exercise today. Oh, it's a bit cold. Oh. The underlying cause of the problem, incorrect breathing, is never treated. If your child needs Ventolin, the breathing is already incorrect. But even worse, if they're taking Ventolin daily, or worse still, the very strong, long-acting drugs Seretide or perhaps Symbicort, then look, Ventolin's a bit like a Panadol for a headache. If they're taking Seretide and Symbicort every day, that's like taking 4 codeine forts morning and night every day of your life in case you get a headache next Thursday or Sunday afternoon. You just wouldn't do it. Clearly you need to take something if you can't breathe, but you should just take enough medication to get relief. See the link that Cornell University discovered between asthma deaths and these long-acting bronchodilators. Of course you want your child to have great teeth and jaw development, but if their lips are not closed, their tongue will be exerting forces in the wrong place against their bottom teeth. The best thing that you can do to ensure that your child has a beautiful smile is to make sure their breathing is okay now. Don't wait until they're in the chair in the teens, looking forward to extractions, jaw advancement surgery, braces and big dollars. I know, my poor son Thomas went through all this. Parents these days are so busy with both careers, music lessons, swimming lessons, soccer practice, expensive schools, and this plays into the hands of the quick fix medications these days, drugs and surgery. Wouldn't it be better to try and correct the cause first, or at least in conjunction with the symptomatic treatment? I'm Brian Firth. I've taught over 6,000 people full-time for 10 years, kids from 5 to 95. I urge you to contact me to find out about breathing retraining, how in 90% of cases can resolve these distressing chronic kid problems quickly. Instead, long-term health problems only ever treated symptomatically. Fix the cause, don't just treat the symptoms. Long-term, permanent, incorrect breather. future, sleep apnea, snoring, etc.